So this package will pay for the biggest expansion of Victoria's intensive care capacity in Victoria's history. We currently have about 450, about 500 intensive care beds in Victoria, and now we're going to fund another 4,000 intensive care beds, taking us to a total of 4,500. So essentially what this package will pay for is firstly some capital funding there to create new spaces for intensive care beds at the Alfred, at Monash and at the Austin Hospital. So that will create another 300 new spaces, taking on top of the 269 beds that we announced recently. And in addition to that, the vast bulk of this funding is actually for the consumables and the equipment and the personal protective equipment that will be needed as we go forward. So 1.2 billion of this 1.3 billion package is to actually upgrade existing acute beds and to effectively turn them into intensive care beds. So what's special about an intensive care bed and how does it differ to a normal hospital bed? It's essentially the equipment and the staff that go with it. From the ventilators to the IV infusion pumps to the patient monitors, dialysis machines and all the other sophisticated medical equipment that will be purchased to be put around these beds and to upgrade them from acute beds and to turn them into intensive care beds. As the Premier said, this is worst case scenario planning. We certainly hope that we will never need to actually use this type of capacity in Victoria, and it's incumbent on all of us to do our bit and to make sure that this capacity won't actually be needed. It fills me with dread to think that we may have thousands of Victorians on ventilators in intensive care beds. If we all follow the social distancing rules, if we all stay at home, then we can flatten the curve, slow down the spread of this virus and hopefully not need to use this capacity. But of course we need to plan for the worst, and that's what this significant upgrade of our intensive care capacity is. As part of the package as well, there is also a component for training. We are effectively training up our workforce. We are taking nurses who might work in our acute beds, in other wards, in our hospitals, and giving them the intensive training that they will need to be able to work in an intensive care unit capacity. Similarly with anaesthetists and clinicians who might work doing different type of work now, they will be trained up so that they can provide support to others in an intensive care unit setting. So this package will pay also for personal protective equipment, from 550 million gloves to hundreds of millions of masks and gowns and all the other equipment that is needed to keep our dedicated healthcare workers safe. So we have put a lot of thought, a lot of planning, working very closely with our health services to make sure that they are prepared. And as I spoke about in the last few days, we've also worked very closely with the Commonwealth to be able to bring the private system to be effectively merged in with our public system. This is what is being described as the Victorian Model, us effectively running private hospitals in Victoria, being able to direct which patients go where, so that we have the whole health system in Victoria working as one to make sure we can best utilise that capacity. So that effectively brings 9,000 beds from Victoria's private hospitals into our system, as well as of course their intensive care beds. So I'll leave it at that, and happy of course to take your questions. But just to stress again that this is a massive scaling up of Victoria's hospital system to make sure we are ready for the peak of the COVID-19 pandemic. We certainly hope that we never need to use this capacity if we all do the right thing. We follow strictly all the social distancing rules in stage 3. We stay at home as much as is possible, follow all those rules strictly, then we hope that we won't need to use this capacity.
How long do you expect this scale-up will take to implement?
Sure. So we are getting on with doing a lot of the construction that we have announced already. So, for example, at the old Peter Mac, the construction there will start in coming days. We are getting on to expedite this process so that we will have construction work underway in terms of creating those physical spaces very, very soon. We are aiming to have all of this work ready sort of in the next 8 to 12 week period, and will vary from hospital to hospital, but we've got all the equipment on order that we need. We've got a lot of that already arriving. We are effectively creating our own stockpile here in Victoria of personal protective equipment so that our public hospitals can rely on that, in addition to the national stockpile. So we've got all of these things in place. A lot of this work has started some time ago, so we can make sure we are ready for the peak of the pandemic.
Will you need other for the PPE to arrive with reports of nurses being told to recycle people that they're wearing? How long will that be working?
So we had 1 million masks just arrive last week. We're expecting another 1 million masks to arrive this week. So a lot of these things are already starting to arrive. We've got a lot of equipment on order. Of course, I have acknowledged in the past that there are international supply chain issues. You know, we are working very closely with the Commonwealth. We're utilising our diplomatic channels. We're utilising every opportunity, including potentially using the Australian Defence Force to fly some of that equipment into us. So we will take every opportunity to make sure that Victoria is well prepared. I've spoken before about how we're also looking at local manufacturing capacity. We work very closely with the Commonwealth to assist a local mask manufacturer here in Victoria that's now producing masks for our public health system. So we are looking to scale up production of a lot of that equipment, and we'll have more to say about that in coming days and weeks.